Hello, my name is Kayla Bratton, and I'm currently pursuing my master's in healthcare leadership. And I'm so glad to have the opportunity to present this research that I've been doing these past few weeks regarding tackling malaria in Ghana. During this presentation, I will be providing you with the gathered data in regards to malaria progression, transmission, and reemergence. I will also be presenting key information needed in order to become a part of the global responsibility we all have to collectively combat this disease. Ghana, formerly known as the Republic of Ghana, is located in the West Africa region along the coast of the Gulf of Guinea. It is classified as a lower middle income country based on the country falling below the World Bank's lower income bracket. These brackets are based on gross national income per capita and fluctuations in the development of its economy. With a population of around 34 million, Ghana continues to advance and develop. But despite continued development, there are parts of the country that have been devastatingly stricken with poverty. This includes lack of food, clean water supplies, sanitation structures, and healthcare access and opportunities. Malaria, known as the disease of poverty, is the fourth leading cause of death in Ghana, surpassing even HIV and AIDS, along with tuberculosis. Malaria happens when a female mosquito bites and spreads a parasite, causing those who are bitten to become ill. This is also known as a vector. Although treatable and preventable, it often goes untreated in areas of poverty due to lack of healthcare access, awareness, and education. Globally, malaria affected around 241 million people and caused over 600,000 deaths in the year of 2020 alone. In Ghana, every person is at risk without taking those correct preventative measures, but children under 5 and pregnant women are the most vulnerable. The country contributes to about 2.2 of the total malaria cases in the world and remains in the top 15 countries with the highest malaria burden. Malaria in Ghana is driven by several key factors, such as lack of adequate housing, meaning housing without the proper structure, such as doors and ceilings, lack of adequate health care, such as underfunded facilities, and limited access to proper diagnosis and treatments, and also climate change, which creates ideal breeding conditions for infected mosquitoes to reproduce. Malaria is known as a recurrent disease due to commonly used insecticides and anti-malaria medications being exposed to things such as resistance and mosquito mutations. This often amplifies the use of vector control tools and the methods used to get these concerning health global issue under control. Although there is quite a ways to go, there have been great strides made in the progression of malaria initiatives and awareness. Initiatives such as the Substantial Development Goals play a key role in global partnership and awareness needed to adequately combat this disease. Out of all 17 of those goals, a couple in particular play a critical role in the fight against malaria. The one that speaks to me the most is number 3. This is good health and well-being. This goal's purpose is to ensure healthy lives and promote well-being for all ages. This health goal directly relates to the fight against malaria in Ghana based on initiatives that have already been set in place, such as providing those sick families and households with insecticide nets and residual sprays, developing access to rapid diagnostic testing for early detection, and promoting health education so we're able to identify symptoms before they become fatal. Target 3.2 of goal number 3 is by 2030 end preventable deaths of newborns and children under 5 years of age. This is especially important since 76% of all malaria deaths in the African region were among children under the age of 5 in 2023. I also want to be sure to discuss the Global Malaria Program. This is a critical health initiative led by the World Health Organization with some support from the Malaria Policy Advisory Group. It plays such a vital role in the fight to eliminate malaria, especially in high burden countries such as Ghana. The primary goal of this program is to expand access to proven malaria prevention tools and strategies. This includes everything from effective vector control to providing preventative malaria medication and implementing vaccines in international health plans. Primary prevention practices not only stop malaria contraction, but stops transmission at the source. The Ghana Health Service also acts as a national implementation partner between these initiatives, assuring that all of the malaria efforts are in line with the World Health Organization's guidelines. They coordinate malaria campaigns, deploy trained healthcare workers, and continuously monitor and report malaria progress. The efforts are also enhanced by the Health and Policies approach. This is a cross-sector collaboration that includes not only health, but agricultural, environmental, and educational policies as well, all of which directly link to the fight against malaria by addressing those broader determinants of health. It goes beyond the scope of strides already made. The results of these initiatives speak great volumes, with malaria incidence in the African region dropping by 37% and the mortality rate dropping by an incredible 60% in 2023, highlighting the importance of coordinated local and global action. But this is only the beginning. In order to attain a malaria-free world, we must continue to do the work required to eliminate this disease once and for all. In conclusion, malaria remains one of the most significant public health challenges in Ghana, as well as other parts of the world. It affects countless lives when it doesn't have to. Despite all of the progress made through national strategies and global partnerships, factors such as poverty, limited access to healthcare, and environmental conditions continue to drive its prevalence. However, continued global efforts such as sufficient investments in prevention practices, stronger health systems, and community-based initiatives have the potential to dramatically reduce malaria cases or even eliminate them altogether. Ending malaria is not just a health goal for certain parts of the world. It's a step towards sustainable, developmental, economical growth, and improved quality of life for all. If there are any questions or concerns regarding the information that has been presented here, please feel free to contact me at k.bratton@leomel.tamuc.edu. I look forward to connecting with you all. Thank you.